for the meeting from January 4th. So we'll need to approve those next time we meet. So I guess from a COVID update, we are a little bit better positioned here locally than we were a week or two ago. We're still seeing a high amount of COVID, but the numbers of certainly of hospitalizations, of admissions peaked in the week of the 14th, from the 8th to the 14th. So they are down a little bit, but they're still very high numbers. So the healthcare system is definitely stretched to the brink. It's as I've said to some people that have asked, I've never seen the National Guard in the hospital before. So so as you saw, the governor deployed National Guard. I think we have 8 guardsmen in the hospital, and they're providing really critical non-medical help. So they're helping us with all the things that need to happen with moving patients and helping with patients and, you know, all those other things that you don't think about in healthcare that are absolutely critical to the mission. So so it's still, you know, it's still certainly a struggle, but we're kind of working our way through it. I guess the good news is, for whatever reason, we're not seeing much flu again for the second year in a row. There is some flu in the state, but not what we typically expect. In a typical year, in the week after New Year's, we begin to see a rapid rise in influenza that continues through February. And we haven't seen that. We really haven't seen nearly as much as we would expect all throughout the country, which is kind of interesting. So certainly masking helps with that. But, you know, if you look at the one metric that I look at from the state to get a sense of where COVID is in the town is the percent of positive tests. If you look at that number, it's, as of today, the 7-day average is 25%, which is still a high number. It peaked 2 weeks ago at 29%. So it's down a little bit, certainly headed in the right direction. Just to give you some perspective, in the middle of November, you know, the number is 25% today. That number was between 4 and 6% before Thanksgiving. So certainly a low number. And, you know, the CDC, from a masking standpoint, likes to use the number of 5% as a cutoff where you could potentially stop masking. So yeah. I'm not commenting on what the governor will do with masking at all with that, but that gives you a perspective of kind of where we are now versus where we were not too long ago. The good news is, if you look at the modeling, the anticipation is that the number of positive cases should dramatically drop in February. That's based on the experience in originally in South Africa, but we're actually seeing that where Omicron hit first in the country, mostly in the Northeast. Those numbers are coming down, and certainly our numbers are following that here locally. So hopefully we'll see continue to see some good news pretty rapidly. Locally, there's no doubt that the people that are hardest hit by, and this is almost all Omicron in the state now, the people that are hit the hardest are the people that are completely unvaccinated. There's no question about that. The people that have received 2 doses of the mRNA vaccine, when they do get sick, they tend to be not nearly as ill as the unvaccinated. And certainly the people that have been boosted do the best with it. And remember, the vaccine was never promised to not or prevent infection. It was designed and promoted to prevent hospitalizations and mortality. And it is doing that. So the toughest thing is that the people in the community that are immunocompromised that wind up getting exposed, those people are still struggling with Omicron. So the hospitalizations tend to be a little bit shorter than what they had been for the Delta variant, but they still, you know, again, these people that are infected with COVID are, you know, hospitalized for a long period of time. And then the struggle is the people that do the worst with it tend to be sick for a period of time and then get sicker. So those people are hospitalized for, a couple weeks, unfortunately. So, it's funny when I look at the state data, they talk about vaccination rates and they describe people as being, quote, fully vaccinated with 2 doses. And really, at this point, in my opinion, that's not fully vaccinated. I mean, fully vaccinated is boosted to give you the optimum benefit from the vaccine. If you look at the numbers for people here in the county, and I look specifically at the age group of over 65, 96% of those people are what are described as fully vaccinated with 2 doses, but only, I think the number is 38% have been boosted, which is a really, really low number. And those numbers come off the Delaware, the My Healthy Delaware website. But I think we need to do a better job as a healthcare community of conveying the need for that third or the booster dose. So that's kind of where we're at right now. I think since we last spoke, there was some more guidance from the CDC, which was not really land-breaking news with regards to masking. Clearly, if you can wear an N95 mask, that provides you the most protection from getting Omicron or getting Delta, or I'm sorry, getting COVID period from anyone. Surgical mask, less so, and then a cloth mask, the least amount. That wasn't really groundbreaking news, but that has been in the paper, in the news sources recently. So, anybody have any questions where we're at or what's going on?
Well, I see that in the paper anyway, there's been a big increase in the pediatric patients. Now, if those come to BB, are we keeping them here or shipping them up to AI DuPont?
So most of the pediatric, so you're correct that there's more pediatric patients that are COVID positive. However, the vast majority of those patients really aren't that sick and don't require hospitalization.
Okay.
In the earlier waves, we just didn't see the kids getting it really much at all. But now we're seeing it, but most of them don't require hospitalization.
What do they consider a pediatric patient to be fully vaccinated? Is that 2 shots plus a booster, or?
I think based on when they were approved for kids, they are not eligible for the boosted dose just yet.
That's what I thought.
Yeah. But when they get to that 6-month point or 5-month point now, they would be eligible for it.
Right.
What we've seen in the pediatric population is most of Omicron has been, the difference between that and Delta from a medical standpoint is the Delta variant seemed to attack the lower airways more. So more pneumonia. This has been more of an upper airway issue with a much more like kind of cold-like symptoms. So we've seen some of the pediatric patients have those cold-like complications, croup, those sort of things. But they're doing really well with it, generally.
Right.
All right. Dr. Callan, I saw that Merck Foods had posted on Facebook. They were at the high school Saturday giving Pfizer vaccine. Did they have a good turnout? Do you know?
I don't know, but we do have a specialist in the high school right here. Hi, Bob.
Yeah, we're able to have that program at our high school. I haven't gotten the exact numbers, but I know there were plenty of people sign up ahead of time even, which is a good sign when people are
good.
We're trying to offer as many opportunities as possible, and even to have the van, the truck outside the high school, once a week. It's amazing how many people have used that. The initial thought was we would use it for our staff so we could kind of have that weekly testing for those who chose not to vaccinate, but we're able to use it for that and others in the community that really want to get tested and just stay on top of it. So it worked out well.
Paul, you mentioned that the number of people who've gotten the booster here in Lewis are somewhat slight. Is there something we should be doing to encourage people to get the booster?
So I have, as I look at my notes right now, I misspoke. So in the county, for people over 65 years of age, the number of people that have gotten 2 doses is 96%.
Mm-hmm.
The number of people that have gotten 3 doses is 69%.
It's not nearly. That's better. Yeah. Okay.
The 31%, I think, is a number um, for all comers from the state. So
Okay.
for all ages, but for over 65, it's 69%. I
That's
apologize.
better, but we still should probably be encouraging, stressing the importance of getting the booster if you can.
Yeah, I think that there was a fair, as in early January, I talked to a lot of people that were scrambling around trying to get a booster dose, that it kind of put it off through the holidays just for whatever reason. But yeah, but at this point, you really should get the third or the boosted dose.
Yeah.
Gives you the best protection.
Right. Okay, thank you.
Yep.
Yeah, we've been trying to obviously push as much as possible, provide opportunities for vaccinations whenever we can for staff or for students. So that's been an ongoing effort. Those numbers have crept up slightly. I think our grades 6 through 12 students are at the top or near the top of percentages in the state of other districts of students being vaccinated. And in our students, our younger students, it's 5 to 11 of age, we actually had, even though the number wasn't as high as we'd like to see it, it was the highest in the state for any school district in the state for our young elementary students. So that's, always want to be better, but it's nice to know that more of our families are taking advantage of that. It really has made a difference for us to kind of keep things afloat here and to keep kids in school. So we appreciate all those efforts.
Yeah, I think that goes along with the vaccination. The vaccination rates on the eastern side of the county are higher than the western side. So that's certainly good news. Bob, I was thinking as I've kind of watched through COVID, I never appreciated the public health impact of the high school property. It is just, as it turns out, it is uniquely positioned and has road access. I mean, it's been a huge godsend to helping.
That's good. Yeah, it has worked out well, and it's really set up and kind of designed nicely to have plenty of parking, to have the rotunda area, then have the large cafeteria right off of that to use for different, either testing or vaccination opportunities. And yeah, that really has worked out, and it's a central location for many. So
yeah, is the curative van? How often are they there?
They're here once a week, Thursdays. We also have a curative van, I believe, at another location, our location as well. I don't know the schedule for that van, but we try to have them there as well once a week. And mainly because it gives us another opportunity on the west side of Route 1. And it's also at the consortium where our, one of the largest staff populations is at our Sussex consortium. So we want to make sure that's sort of more accessible to the Milton schools and to the Sussex consortium school, which for those that need tested is closer to where they are.
Sure. Yeah. So Ted, from a town standpoint, are you having any issues with COVID?
I think, we continue to encourage our staff to get vaccinated. That the pickup rate has not been great, but we have had more people. It's improving.
Yeah, it's gotten much better. We have, and Shelby's on, let me bring her up. We have very few unvaccinated staff now.
Good.
How about the mask mandate? Is that being followed pretty well in town?
I think certainly at City Hall is, and when you see people out on the street, it looks like it is, in stores and restaurants, and like certainly Weiss is being very diligent about it, but I think it really depends on individuals. But Shelby's on; she can give us some more information about actual staff. Shelby.
Hello. Yeah, so right now we currently have 8 out of the, let's see, 51 total, and that does include some seasonal that are working, but 8 are unvaccinated, fully unvaccinated. And we recently just enacted the booster policy. So if you were not boosted, then you had to start weekly testing this week. And we have one person who is not boosted, so we'll have to add to that weekly testing. Everybody else is boosted.
That's a big uptake in the last 6 weeks. That's great. Thank you.
Just from a, how many positive tests that have you had from testing your employees?
I'm
Do you
sorry.
know? Have you had any employees that tested positive in a weekly testing?
Yes, the last couple weeks, there's been an increase. Some of that was from them having symptoms and then testing. And I think 1 or 2 was a result of just the weekly test, but we were seeing mostly negative all the way up until just about 2 weeks ago.
Yeah. That corresponds with the spike in the Omicron.
Is the at-home testing being counted in any way?
No, we use the PCR, the PCR test they have to have, which I don't believe the home test counts for that. So they have to go to a location with that testing.
Yeah.
Which I think most
know
of them
we
are
had,
utilizing the curative sites for their testing.
I'm sorry, Shelby.
Oh, sorry.
I know we had, you know, something that happened the other day where somebody wasn't feeling well and the supervisor had a home test and the employee took the home test and then went and once it was positive, went home and quarantined, but also got the PCR test just because they're more reliable. So I mean, people are using them, but those who are required to test weekly, we're not counting that.
Right. On a civilian side, I'm aware of some employees in downtown who are coming in to merchants and their employer and saying that their children are testing positive. And so are you seeing an increase in the number of children that are testing? I mean, you said that earlier, but that are then infecting adults? In this case, the adult that I'm aware of he's not tested positive yet, and he has had the vaccine, but he's got 2 children at home. One's a special needs child, and another one is just a regular 3rd grader, I think. And but both of them are now positive.
Yeah, so we've seen more pediatric patients that are testing positive in this wave than we've seen in the previous waves. So it's not surprising. Of course, everybody that they live with is, at risk. So it kind of comes with the type of disease it is, unfortunately.
Right.
Hopefully the parent won't get it if he's been completely vaccinated.
Yep.
Certainly, if he does get it, he should have relatively mild symptoms.
Right. He has isolated himself, so that should help him.
Yeah.
I do want to mention Susan had a question earlier about the vaccination clinic at the high school this past weekend, and I did get updated info as we're on the meeting here. We had 133 vaccinations provided.
Good.
16 of those 5 to 11-year-olds, 42 were 12 to 17-year-olds, and the rest were for adults in the community. And we're doing another vaccination clinic in 3 weeks.
Nice. Who is sponsoring that clinic? Are you doing it yourself, or is it the public health?
Aspira, I believe the last one was Aspira.
Good. Okay. Jim, when you were talking about home test, that actually dilutes the numbers that you see from the state, because if you have a positive home test, unless you get a PCR test that's ultimately reported to the state, you become an unknown positive, really.
Right.
A lot of people that had positive home tests and they were sick, so there's no reason for them to get a confirmatory test. They were just sick, so they stayed home. So I think those numbers are artificially low, but certainly you can follow the trend. The trend is heading down from where it was a week ago, so we'll follow that.
If they're positive, they still should quarantine for at least 5 days. Is that correct?
Correct. So the current standard from the CDC is to quarantine for 5 days, and then if you are clinically improving and have not had a fever for greater than 24 hours, not taking Tylenol or Motrin, then you can stop quarantining, but it's recommended that you wear a tightly fitting mask for the next 5 days for a total of 10 days. So, Anne Marie, were you able to source N95s for city employees?
We've got KN95s, not N95s.
Uh-huh.
So we've been making them available. We're not requiring that people wear them. So some people have chosen
Sure.
to stick with their other masks.
Yeah.
So
And again, the difference between a KN95 and an N95 is the country in which it's manufactured. So N95 is a standard for the United States, and KN95 is a standard for China. And there is another product that is that I'm blanking on from another country that again has a letter and a number that is not 95. It's like 94 or something. Essentially, all those masks provide a greater level of protection than a plain surgical mask. There is apparently a fair amount, or there is some counterfeit KN95s on the market, and the CDC has some recommendations as to how to tell which ones are counterfeit and which ones aren't. But good. I think that's from an employer standpoint, it's responsible to have those available for people that are willing and to use them. That certainly those N95 masks or KN95s are a little less comfortable than a whole lot less comfortable than a surgical mask, but you know.
I find the KN95s actually more comfortable. The N95s, I agree, are because they have the two straps that go all the way around your head.
Right. Well,
Great
but
for your hair and all that.
I like that better because the ones over my ears always tangle up in my hearing aids.
yeah, it's a good point. You know, the true N95 should be fit tested, and you know, when the mask, the more comfortable your mask is, potentially the less benefit you're getting from it. So it's sort of a trade-off. But I agree that I've worn some KN95s that are a little more comfortable. But
Supposedly there are free masks available in your local pharmacies, but what are they? Are they the 95 or the KN95? Does anyone know?
I have not seen anything. I've seen surgical masks for sale, but
Right.
I'm not aware of
The News Journal this morning said they were going to be available free in the local pharmacies, but that's all I know. Of course, the News Journal is not always right.
Really?
I paid for any masks I bought at the pharmacy. I mean, I bought N95s at the pharmacy a while ago and I paid a lot. So I know they weren't free.
Yeah.
Well, has COVID, the impact of the increase in number of patients impacted the ability of BB to do elective surgery and other things like that?
Yes, it's very much so. So we, in a tiered approach, we limited elective surgeries that were going to require an overnight stay the first week of January. And then from there, we moved to limiting all elective surgeries, except very selected cases, the following week. And as we go out from here, we'll see what we can, you know, what kind of capacity we have, what we can kind of add back. But what we've learned from the original surge with COVID is when you know, elective surgeries, you call them elective, but they're only elective that day, and then they actually need to get done. So at some point they no longer become elective. So we're trying to prevent that.
Right.
So it is you use the term elective, but it's not elective if it's you.
Right.
So
No, I'm aware. I was aware of that, but I just didn't know how it had impacted your scheduling. And you're right. A lot of people early on postponed or had been put into a postponement, and then those things became something that were much more urgent to be dealt with.
yeah. So I think We are hoping to get back to having a much more normal surgical services over the next couple weeks. So I certainly know that my friends that are surgeons are very anxious to begin to kind of take care of their patients again. So, but we are, as a health system, we're making it.
Yeah.
We certainly are stretched to the brink, but are getting through this. I'm continuously impressed with how hard our staff works. You know, in the emergency department itself, we have a lot of patients that are waiting for inpatient beds, and they're there for, you know, even a couple days at a time now. So we don't have the beds in the department to see the normal emergency patients. So what we've done is we are seeing those people really kind of anywhere we can. You know, many of those people stay in our lobby. We see them, and the nurses that are working in the lobby now are unbelievable. I mean, it's really challenging work, and I'm amazed that how hard they work day in and day out. So I know they're tired, but they come back every day and work really hard. So it's great to see.
Right. Are you bringing in a lot of temporary people?
Yes. So one of the struggles in healthcare across the nation is that there is a shortage of nurses. A
Right.
lot of nurses have left the profession.
Right.
So what has happened is it's created these travel assignments which have always existed, but everybody is using as many travelers as they can now. And it's good for the nurse, not great for the organizations, but the nurses are now leaving their full-time post and taking travel assignments, or typically 13-week assignments. They go to another hospital and they make a lot more money. And it just creates this shifting of nurses where our nurses will go somewhere else, and then those nurses will come back here. And it creates it's a challenge for our staffing people, without a doubt. But we are, as an organization, we are hiring more people. We hired more people in the last 6 months than we've hired in the previous year. And that's in the setting of, you know, trying to hire we have positions all over the place. So there does appear to be an uptick in the number of people that are looking for full-time employment, which is great. I had a conversation with our human resources director this week, and they had a recent job fair, and they had many more people at the job fair than they had in the past. So she's cautiously optimistic, but we are using as much contract labor as we can, as is every hospital.
Are you able to use any of your nursing students to help, you know, get them some clinical experience and then fill some of the obviously less complicated gaps?
So a lot of our nursing students in their second year, you know, do some stuff in the hospital, but not as part of their education.
Okay.
We, you know, kind of keep them with their instructors, although they are in their second year, they are in the hospital doing clinical stuff. So they are a help just because they're there. We're really fortunate that we still have a nursing school. You know, a lot of, you know, the trend over time has been to get rid of your nursing school. And we went in the different direction, you know, 10 years ago. And it's really been really helpful for us. You know, we have a steady stream of potential employees. And, you know, the other programs, you know, Deltec has been producing a fair amount of nursing students for us now recently. So, but we're like every other health system where we need kind of everybody we can find. So, and most importantly, we're looking for ways to keep our current employees the best we can.
It'll be interesting to see whether or not this whole COVID experience has an impact on the number of people who are actually signing up to go to a nursing school or enrolling in nursing schools. Whether, you know, people hear, you know, about the difficulty of working in during this pandemic, and then they go, well, this isn't a field for me, or maybe vice versa, that they'll feel more strongly about doing it. It would be interesting to see how it impacts recruiting for the School of Nursing.
Yeah, I actually think that it will increase the number of people that are potentially interested, because when you look at how much money you can make as a nurse right now, the number is huge, and that may draw some people to the profession. Now, like, I'm old enough now that I've seen this cycle of nursing a couple times where we don't have enough nurses now. In a period of time, we'll have too many nurses, and then the nursing jobs will be hard to find. And it is in some ways cyclical, maybe not like a perfect cycle or a circle, more maybe oval. But it's like a lot of things, it regresses to the mean. So,
Sure.
But we certainly, in a state and in a county where the population is growing as much as it is, healthcare is definitely going to be a much needed industry here, and employees are going to be key for that.
Yep.
And really not just, we talk about nursing, but it's all of the other, it's really every other position in the hospital, from the guys that keep the place warm and cold, to our food service people, to our nurses, to all of our other allied health people. We really kind of need everybody.
Yeah. Well, it's having spent as much time as I did at MedStar, I can tell you in DC, the shortage is just as critical, or perhaps even worse.
Yeah.
It's really amazing.
Are there any community activities coming up that we should be aware of as large gatherings of people? I'm not aware of it.
There isn't anything that we're aware of. Nothing scheduled for as far as the city's concerned. The next big event that potentially would draw people is the Little League Parade, and that's not until the end of April.
Right.
I think we don't. The Martin Luther King Parade was canceled last weekend, so I'm not aware of any major activity.
Right.
Was that canceled due to COVID concerns?
No, I think they just couldn't get it. They couldn't get enough people to sign up for it. It's always been a difficult parade because of the time of year it is.
Sure.
And I think they voted, about a week prior, just to not abandon the idea of trying to have it.
Sure.
Right.
Bob, do you have anything that is coming soon? It's
Just nothing other than athletic events that we continue to have. The winter season, wrestling, basketball. We've managed through it, and obviously we're masking inside and trying to police that as much as possible. But we have no other large events coming up.
do you have any restrictions on the number of attendees for the winter events?
No.
Yeah.
There are some places in the state that have gone that direction, in northern Delaware, I believe, with 2 or 3 or 4, I guess, tickets per participant.
Mhm.
At this point, decided not to do that here. I don't think anybody in Sussex is doing that at this point. And the trends are encouraging. I look at the county data every day, and the zip codes of 68, 71, 58, which make up primarily our entire district, and those numbers have decreased each of the last 3 weeks, which is really encouraging. And actually, yesterday's total positive cases for our zip codes was the lowest it's been since December 27th, which is encouraging. We just want to kind of keep that going and keep sort of our mitigation strategies in place. We have received and will be distributing KN95 masks to make them available to all employees and to our 6th through 12 students. We'll be doing that in the next few days. That'll be another thing that we'll be doing, as well as the testing and the vaccination clinics. And we're just trying to do everything we possibly can to keep that going, and also to keep people in school and keep students in school, and trying to find ways to kind of cultivate our sub pool as well, so we can kind of, when we do have absences, we have coverage, whether it's for a paraeducator or a bus or a teacher, whatever it is. So trying to think of creative ways to do that and kind of keep things moving, because we have been fortunate to this point. Many other districts have had to close for a few days at a time because staffing limitations, and although we've had challenges, we haven't gotten to that point to do that. So,
Yeah. Well, good. I certainly agree with your assessment that the trend is headed in the correct direction. So what you've been doing so far, if it's worked, is probably the correct strategy. So, okay. Do we have any other comments, questions?
No, but we probably should set another meeting.
Yeah.
You want to go like about a month out, towards the end of February?
I think that sounds reasonable. Let me pull up my schedule. Is February 23rd, it's a Wednesday? Does that work
I
okay?
will be away, but go ahead.
Okay.
Works for me. How about you, Anne Marie?
I have a doctor appointment, but I can actually change it. So
Okay.
Are we thinking 9 o'clock, Paul?
Bob, does that work in your schedule?
I can make it work.
Great, thank you very much. I have said this to you a couple of times, Dr. Fulton, but having you here has been very additive. I really appreciate you taking the time for it.
Very
So-
helpful.
No problem. I think I get a lot out of it too. So I appreciate the invite, and glad I sort of able to help everyone as well, and kind of keep groups connected and kind of just aware of what's going on, and it helps me understand what's going on in town and community as well. So thank you.
And Susan and Jim, I also appreciate your input also. Oh,
I do want to say that we do get a good bit of positive feedback for, having an active Board of Health that has regularly been meeting to talk about, the on the ground local situation. So, I would thank all of you for the time that you make for this, because I think that the public does appreciate it.
Yes, and of course, it goes without saying, we thank the hospital for all that you have done, you, Dr. Tam, and the entire leadership team in stepping up to meet the demands that are coming from the community to help us stay on top of this as best we can.
well, thank you. All right. Well,
Okay,
thanks, everyone.
enjoy the day. Thank
Yep,
you.
all right.